If you have lower back pain that's off to one side, I want to help you to get rid of it. I'm Dr. Jared, and these are some simple stretches and exercises that you can do to alleviate this one-sided low back pain and feel better fast. In most cases, this lower back pain that you feel off to one side is muscular in nature. You've got a couple of muscles in there, your quadratus lumborum and some other paraspinal muscles that sit in that area, or it could be the way that your vertebrae are moving with each other. They're not moving the way that they should, and that can also cause pain. In either case, these are the stretches and these are the exercises that should help to alleviate this pain. So the first thing that we want to do is some sort of mobilization to those tight, painful muscles. This is a great way to promote relaxation and to just get them ready for more movement. The ways that I like to do that, the first thing that I have, this is called a theracane. And this is really easy. You can use this to kind of wrap around to your back and apply trigger point pressure up and down and kind of do a massage that way. I do have this linked below. This is a great tool. But if you don't have one of those, most of you out there, I'm assuming, you can do the same thing with a simple tennis ball. What you're going to do is lay down on your back with your knees bent, and then we're just going to put that tennis ball right underneath your lower back. Not directly on the vertebrae, not directly on your spine, but just off to the side where those tight muscles are sitting. And so then in this position, I can control how much weight I put on it by how much I raise or lower my hips off of the floor. You're going to do this on the floor, not on the bed, or else that tennis ball sinks into the bed. And so you can use your hips to control how much pressure is in that area. And then what we can do is move our hips from side to side. You can move your hips up and down, and we can just kind of massage that area. I'm gonna reach back here with my hand. I'm gonna move it up. I'm gonna move it up a little higher. I'm gonna move it down a little lower. You can just kind of find those areas that need a little more love, that need a little more attention, that just need to be released with this trigger point mobilization. And so on this, I usually recommend about 2 to 3 minutes. Most people love the way that it feels once you're done with that. After that's done, let's get into some stretches. So in this position, we can go right into a lumbar rotation stretch. If that pain was on my left side, I'm gonna lay down on my back, I've got my knees bent, and I'm gonna drop both knees over towards my right side until you get a good stretch up here into that left lower back. You can hold that for 10 to 20 seconds, and then I would repeat that 3 times. I usually like to go to both sides, but if you just have that pain on one side, you should be able to target and isolate that one side. If that feels good, I like to show a progression to this that in my opinion is a little more effective. Let's say that pain is still on that left side. What I'm gonna do is straighten my right leg out, and then with my right hand, I'm gonna grab the outside of my left knee, and then I can use that to pull over here towards my right until I get just a really good separation, a really good opening up all through that left side. And again, I would hold that for about 20 seconds and then repeat that 3 times. My back actually just cracked with that. Again, if it's a problem in your vertebrae, if it's a problem like in your spine itself, this is a great way that you can actually self-mobilize that spine, and feels better if you can do that. And so then the next exercise that I like is going to be a piriformis stretch. What we're going to do here is stretch out the deep hip rotators that often get tight. That tightness in your lower back often creeps to above the hips and below the hips. This is a great way to stretch that out. If it were still on my left side, I'm gonna cross my left leg over my right, and then with my hands, I'm gonna grab right here behind my right knee, pull that right knee up towards my chest just until I get a good deep stretch in that left glute. I would hold that in a comfortable position for 20 seconds and then repeat that one 3 times. And then the last exercise that I want to show you here on the table is going to be a variation on a child's pose stretch. And so the child's pose, this is one of my favorite stretches just for the entire spine. We're going to put our hands in front of us. We're going to sit down on our heels, tuck your chin into your chest until you just get a good stretch throughout your entire back. Now what I like to show if you have just the lower back pain on one side is from this position, what we can do is then walk our hands to the side. And so if the pain were on my left, I'm gonna walk my hands the opposite direction. I'm gonna walk my hands over here to my right, And what you're gonna feel with that is an opening through that entire left side of your spine. So my hands are over here to the right, and then I'm going to sit down and to the left until I just get, again, that really good stretch all through that entire left side of my back. I would hold that for 20 seconds and then repeat it 3 times. This last stretch is probably one of my favorites for this one-sided lower back pain. In the clinic, we call it the Ballerina Stretch. Let's say that my pain was over here on my right side. What I want you to do is take a big step with your left foot and cross it in front of your right. Now, in this position, you can take your left hand, put it on your left hip, and even just kind of push that hip out to the side a little bit. And what you should feel there is just a good stretch as we create some separation between the bottom of your rib and the top of your pelvis over there on that right side. If you want to take it to the next level, what we're going to do is with our right hand, reach up and overhead and over towards my left as I'm pushing that hip over to the right. And what you're going to get with that is, again, just a really good stretch, basically all through that whole right side, up into your armpit, through your lat, all the way down through that right side, even down into your right hip. That's what we're going for. Keep it in a comfortable position, hold it for 20 seconds, and then repeat that one 3 times. If you've been following along with the stretches so far, your back probably feels pretty good. But I tell patients all the time, we stretch to feel good today, but we have to strengthen to feel good tomorrow. And so core strength and increasing core strength is what we need to do to keep this pain away. These are the 3 exercises that I would recommend for that. First one is going to be some bridges. What I want you to do is lie down on your back with both knees bent. In this position, we're going to contract the glutes, tighten the core, and lift the hips up towards the ceiling. Hold that for about a 3-second count and then come right back down. Now, what I like to do in this specific case with this one-sided lower back pain is to turn this a little more dynamic. So it's a little more challenging, but if you can do it, here's what I would recommend that you try out. We're going to still come up into the bridge, but now here at the top, I'm going to hold my pelvis nice and level, hold nice and strong. With this left leg, I'm going to march all the way up as high as I can here towards my chest, and then lower that right back down. And now I'm going to keep my left leg down, march with my right. So it looks just like this. And what we're doing here is we're taking this and we're adding some dynamic component to the stability component of it. And so I have to hold nice and steady while I'm going through these big dynamic motions. We stretch the lower back out a little bit here at the top. We improve the mobility. We also increase the strength as we go through these marches. And so with that, if you can do it, I recommend about 10 marches on each leg and then repeat that 3 times. So 3 sets of 10 marches on each leg. And then the other thing that I love for this problem is going to be a bird dog, one of the best exercises out there for that quadratus lumborum muscle. And so what we're going to do is come into a kneeling position, down on all fours. I've got my knees under my hips. I've got my hands under my shoulders. Now I want you to hold your hips nice and level, nice and stable as we slowly extend one leg out here back behind. And if that feels okay, that's my right leg going back. I'm going to now reach forward here with my left hand. I'm going to hold this for about a 2 to 3 second count and then return right back to that starting position. And then I'm going to repeat it over here on the other side as well. Again, great exercise to promote stability through your back. We're really going to work that quadratus lumborum muscle with this. And typically here what I recommend is we're going to do 10 reaches on each side and then repeat that one 3 times. This exercise is one of my favorites for functional strength down your entire lateral side. This is going to be a hip hike. The easiest place to do these is up on a stair. Now, if the pain were on my left side, I want to start by standing on the edge of the stair with my right foot. What I want you to do now is drop this hip down. Let that hip fall to the ground. Let the hip fall down towards the ground. You can even lean to your right slightly. My goal is to really elongate the entire left side of your body. Now what I want you to do is take this left hip and raise it up as high as you can, up towards the ceiling until it kind of even crunches up into your side. You're going to feel this a ton in this right hip over here, but as soon as you get to the top of that movement, you'll feel it kick in with the obliques and into those lower back muscles as well. And so kind of a 2-part movement. We're going to work the hips on this down leg, but we're also going to work that whole lateral pillar or that quadratus lumborum and those lumbar stabilizers on that left side. And because this is so effective, I usually recommend time that we keep things even and that we do this on both sides. And I recommend a set of 10 repetitions, and then we're gonna do that 3 times. I hope these help your back to feel better, and thank you so much for watching.